Hi, I'm Caoilfhionn Connolly, reporting for Room Now at ACR. I'm joined today by Julie Paik, who is an Associate Professor at Johns Hopkins and also Director of Clinical Trials at Johns Hopkins. We're going to discuss her abstract 0322, evaluating the role of cardiac MRI in myositis. So Julie, thank you so much for your time today. Do you want to tell us a bit about why you asked this research question?
Yes, so thank you so much for having me here. I was really excited to look at this population because patients with myositis, we don't really think about the heart, and the heart is a muscle, and we always want to determine if there is heart inflammation. We want to be able to treat it appropriately because it can have severe outcomes like heart failure, arrhythmias, and that's something that's a little bit beyond the scope of the skeletal muscle, but extremely important in terms of their long-term health outcomes.
Great, so clearly a very important question. So how did you ask that question?
Yes, so we got some funding to do a pilot prospective study to really screen for myocarditis, which is heart inflammation and we did that by screening with troponin, pro-BNP, so biomarkers that we could test in the blood, and then also cardiac MRI. And what we found was out of the 26 patients that we did as a small pilot study, we found almost close to 30% had myocarditis, even if they didn't even have any symptoms, which was really surprising to us and really taught us that, well, we're just really struck by the fact that we cannot forget about the heart because that could truly lead to poor outcomes.
Great. So were there any particular patients who seemed to be at higher risk or a higher prevalence of myocarditis?
Yeah. So we looked at all different types of myositis patients, but it seemed like the patients who had anti-CoO antibody had a higher risk of more severe outcomes, like severe arrhythmias requiring defibrillator placement and heart failure.
Okay. Yeah. And how should this change clinical practice, do you think?
I think greater awareness is very important because I think in the community we don't think about the heart when we're thinking about someone's skeletal muscle inflammation. They're so weak and their CK is really high, but you're like, oh, I got to treat that. You're not thinking about the heart. I think the first step and the most important thing is to actually make sure we think about it and actually order a blood test to see if there's any heart inflammation. And then if that's positive, not everybody can get a cardiac MRI, but if that's positive, then we definitely want to do the next step and evaluate more rigorously for heart involvement.
Fantastic. And in patients who do have cardiac involvement, does that impact your management strategy?
Yeah, I think it absolutely does because we were surprised that some patients respond to, immunosuppression, IVIG for their myositis, but then the heart inflammation didn't respond sometimes, in which case we needed to expand and further add other immunosuppressants. So I think it could definitely change management, how we approach it.
Fantastic. Well, really important study, and congratulations on all your fantastic work, and really enjoyed your presentations and talks during this program. So thanks very much, Julie. And if you want any further information, you can go to Room Now.